Hello, my name is Christopher Mays, and I'm going to be talking to you guys about trauma assessment today. First of all, with any scene, of course, first comes first is scene safety and PPE. Your safety always comes first. You gotta make sure that you walk out the same way you're walking into the scene. Alright, upon arrival, you should get some information from dispatch, such as like a number of patients. With trauma, it's going to be the mechanism of injury, then how the patient is, what the scene is, a car crash or the patient fall from a tree or a two-story building, like what the scene is, what the scenario is. Your additional resources, if you're going to need ALS, make sure you have them available, call them, have them stand by if you need them. Helicopter, if you need helicopter, if you guys are in a trauma scenario such as in like the Sandia Mountains, rocks tumble, patient gets stuck underneath the rock, you guys are gonna need extra resources such as fire, more hands. Okay, once you get the windshield point of view, make sure you're seeing safety. Once you're seen safe, you're gonna go in and how's the patient looking, general impression of the patient. When you first arrive, what's the patient look like? Is he laying face down on the floor? Is he face up? Is he smashed by anything or against the wall, tied against or stuck against anything? Just what's your first impression of a patient? And then once you go up to them, if they are conscious, try to talk to them and get an airway. If they're conscious, airway, breathing, and circulation, you gotta check their airway, make sure their airway's clear, make sure they're breathing right, make sure their pulse is actually good at the radio if they are conscious. If they are unconscious, you want to check right away at the chronic, and that's going to be your CABs instead of ABCs, so it's circulation, airway, and breathing if they are unconscious. Okay, first of all, with trauma scenarios, depending on it, if they are bleeding, you want to stop the bleeding right away. Apply gauze if it needs more than the gauze, a tourniquet, just make sure you control the bleeding. And then move on, you want to scan the body for any other blood, major blood, so you can stop it right away. Get vitals on the patient, and then doing a head-to-toe assessment to check. You want to check the skull, scalp, all of this, the face, forehead, facial bones, your nose, chin. You want to check if the teeth are still intact, if he swallowed or she swallowed, your patient swallowed any teeth, if they bit their tongue, any bleeding of the mouth. Check their ears to check if there's any brain damage. The ears will be having fluid. You move down to the neck, make sure the trachea is in line, everything's all good. Sometimes if the lung collapses, it'll move over, make sure you watch that. Go down to clavicles, check the clavicles, check the chest, and then you're gonna check the abdomen and move down to the pelvis. When you check the pelvis, you're gonna check for an open book fracture. You're gonna kind of open it, and the patient will know if they're in pain with that. With the legs, you're gonna check the bones such as your femur, and then the lower bone. You're gonna go across like this, so you can feel pushing pressure on the arm, such as like this. You're gonna be, this would be your leg. You're gonna push one down this way, the other one this way. So when you push force against each other, you'll feel a crack. And if it's the leg, you want to check if they have any pulses in their pedal pulses. If they have the CMS, such as the movement, if they can move their toes, or they can feel you tickling them. Check both legs, and then move up to the arms and do the same thing with the arms and the hands. And then you would rotate, if they are on their back, you would rotate them to their side with your partner or by yourself, and you would check the back and the back and the growing in the butt. Check for any bleeding. With the trauma center, usually you will expose your patient to be naked so you can see right away any blood or anything. So with trauma centers, you want to load and go, but you want to stop the bleeding. Make sure you find all what's going on. And if you need ALS, call ALS.